Afternoon, everybody. Before we kick it off today, just a little disclaimer. Please refrain from recording any audio or video or taking screenshots during this webinar. The presentation and the corresponding slides are copyrighted by Robson Forensic and may not be recorded, copied, distributed, or otherwise used without authorization. Today's presentation will be on exploring liability in developmental disability cases from my colleague Danielle Dieterich. If you would like to submit any questions throughout the webinar, there's a Q&A button at the bottom of your Zoom window. You can do it that way, or you can just email them to us at inquiries@robsonforensic.com, and we'll look to get to all those questions at the end of the presentation. So with that, I will hand it over to Danielle.
Hi, good afternoon, everybody. My name is Danielle Dieterich. I'm a supervised care and behavioral health expert with Robson Forensic. Just a little bit about myself. I graduated from John Jay College in New York City with a master's in psychology. And then from there, I went on to earn my JD from Touro Law School. I have 20 years of experience in the management and oversight of clinical and residential care facilities for individuals with disabilities. I've worked with programs that provide day habilitation services, community-based services such as community habilitation or vocational training. I've overseen supportive apartments, respite care, and 24-hour residential programs. Throughout my career, I've worked directly in program as well as held leadership roles with large Medicare and Medicaid funded agencies, where I was responsible for the oversight of over 24 programs, caring for over 200 individuals. At Robson, my forensic casework deals with standard of care cases relating to supervision, policies and procedures, incidents of abuse and neglect, and injuries to residents and staff, among other things. So just to give some background regarding supervised care, in supervised care settings, the programs in the facilities are tasked with providing support for individuals with developmental disabilities or other co-occurring disorders. And this is an ongoing process which involves each individual's circle of support. So who makes up this circle of support? Well, at the center, you have the individual that's receiving services. They're the most important person. You then have their care manager. You have residential staff if they reside in a residential facility, day program staff, members of their clinical team, their family or legal guardian. It could be a neighbor, a really close friend, really anybody who is important to that individual and involved in any aspect of their life. So in these behavioral health or supervised care settings, the individuals can experience what we call a transfer of care from one provider to another, and this can occur daily and include multiple providers. So when you have an individual that resides in a residential facility or even at home with their family, when they leave to go to school or to day program, you have a transfer of care from their home life to their day program setting. And then when they return home, if they have any community-based programming, that's another transfer of care. So this can occur throughout the day across multiple service providers. This is also a field that can be heavily regulated. The regulations for each state are written to provide the minimum standard of care for facilities. And the regulations are often written in a vague manner. And that is to allow each provider agency to develop policies and procedures that are specific to the population they serve and in line with their authorized scope of practice. And each state governing body is responsible to monitor provider compliance with these regulatory requirements. So one of the biggest things that we look at in this field or in this industry is that continuity of care and that care across providers as it relates to that individual. And the most important piece of that, the central piece of that, is the individual's person-centered plan. We're looking at person-centered care. It's individualized. The individual's care plan exists to ensure continuity across all different service providers. So who develops the care plan? Care plan is typically developed by the individual's care manager or case manager. Now, sometimes the titles of staff, titles of documents, language can vary state to state, but it's consistent as far as what those plans are. So an individual's care plan is often referred to as an individualized service plan or a life plan if the individual lives in New York. And it could also be an individualized education plan if the person goes to school. So an IEP or an individualized education plan is for individuals enrolled in school, and an individualized service plan or care plan or life plan is for individuals who have entered into what we reference more adult services. Now, the participants in this care plan is that circle of support that I discussed just a moment ago. The individual, all the important people in their life, the people that are responsible for providing services. And this plan is really going to give you an idea of this individual. So it's going to include their diagnoses, what is the level of support that they need to get through the day? Do they have any sort of environmental modifications that are necessary to ensure their safety? What are the goals that this individual is working on, and who's supposed to provide those goals and work on those things with the individual? So this chain of continuity or continuity of care exists to promote safety for that individual. That's always the most important thing, is promoting safety. And it's also there to prevent errors, breaches in care, or violations of the individual's rights. So these care plans, they're not just a one-off document. These are long-term, they're fluid, they're focused on individual life planning with supports that are needed no matter the environment the individual is in. So some examples, and this is not a finite list, but some examples of supports that would be included in those plans would be behavioral supports, de-escalation techniques. Are restrictive techniques required for this person to maintain their safety? What level of supervision do they require? What safety precautions are required? And then continuity of care across service providers, again, it's so critical, and everybody needs to be aware of what their role is. So if an individual has a challenge with ambulation and they require assistance with walking upstairs and they need that at home, it would be expected that there's communication between the home and any other service provider that this individual requires support when ambulating, because if they need it in one setting, they likely need it in the other. So that communication and information sharing during that care plan development is key. So when we look at the chain of responsibility and who's responsible and what their role is to ensure a safe environment for the individuals, this is not an exclusive list, but it's some of the main categories. So you have your state governing body, which is responsible for licensing and monitoring. They're going to do regular visits to these programs to make sure that they are in compliance with the requirements. You have your program administration, which is responsible for developing your policies and procedures and making sure that the facility is in compliance with the regulations and the requirements. You've got your supervisors or your management team, and those are the staff that are responsible for creating schedules, developing treatment plans, goal plans, and making sure that those plans are implemented. And you've got your frontline staff, which are typically referred to as direct care workers or direct support professionals. And those are the staff that are working hands-on with the individuals every day. So, they're the residential staff, the day program staff, the community rehabilitation or respite providers. Those are the staff that are really running those goals and working with those individuals. And you've got all sorts of additional personnel depending on the services that a program provides. You can have behavior support, you can have nursing support, you might have nutritional support. That's really going to be program specific. So in cases of abuse or neglect, the incident could occur through one link of that chain, or it can be the result of a systemic issue within that agency or facility. And my task as the expert is typically to determine whether a breach occurred and to determine if the actions or inactions of the parties were reasonable while considering all potential contributing factors. So for an example, we have an individual choked on food and passed away. This individual suffered from swallowing disorders with a history of choking and aspiration pneumonia and exhibited behavioral challenges, including impulse control behaviors and taking others' food. They required a modified diet. Food needed to be cut to 1-inch pieces, and they required line of sight or field of vision supervision during mealtime, which is typically defined as staff being able to visually monitor the individual while they're eating. And they lived with 5 other individuals in a residential facility with a staffing pattern of 1 to 3. So in this incident, these are some, not all, but some of the factors that I would consider and evaluate to determine whether or not there was a breach of standard of care, or if their actions and their response to the incident was reasonable. One of the things to always keep in mind is that just because an incident happened, it does not mean that there was a breach of standard of care in these facilities. And I'm going to go through each of these factors and explain my evaluation process and what I would look for when I was in the industry. So first thing I'm going to look at are policies and procedures. Now, policies and procedures can be written, but they can also be unwritten. And an unwritten policy and procedure is something that all staff, all personnel are aware that this is how we're supposed to do this. And they demonstrate an understanding through their actions. So you can have an unwritten policy and procedure. You can have a written policy and procedure. So I'm going to look at those, and I'm going to, based on my experience in the field, look to make sure that the policies and procedures are thorough and that they're in line with the regulatory requirements. I'm going to look at that individual's care plan and their treatment plan, nursing plan. I'm going to look at everything for that individual. And I'm going to assess whether or not the plan was thorough. Did the plan have all of the components necessary? Did it speak to the history of choking? Is there documentation in that treatment plan that the diet needed to be modified and all food needed to be cut to 1-inch pieces? I'm going to look for indication in that plan that the level of supervision is documented in there. I'm going to make sure that that plan has all of the information that it's supposed to have. The next thing that I'm going to look at is the staff training and the competency of the staff. So staff training is so critical in these programs. And it's not just that training was provided. Was that training effective? Was it meaningful? Did it measure staff's understanding, and did it measure and determine staff's competency to implement what they were trained on? So I'm going to evaluate, was this just a training where they were provided written information and they had to read it? Were they given an opportunity to ask questions? Was this a training where they were presented with a live lecture or with video materials? And then how was that competency measured? Were they given a post-test? Did they have to demonstrate a physical technique? Those are the things that I'm going to look at because I want to determine if that training was effective. Then the staff supervision and the staff oversight. Are these staff receiving the necessary supervision needed for them to do their job? Now, once you provide training to staff, it's not, where you're going to just let them go and let them do their thing. They need to be supervised. Somebody needs to be monitoring them and managing them and making sure that what they were trained on is what they're doing and providing feedback. And what I look for, based on my experience in the field, is I'm going to look for documented supervisions, employee evaluations, job performance evaluations, and that's going to tell me if staff are receiving the supervision and the oversight and the management that they need. I also look at the documentation, because you can have the care plan, you can have the training, you can have your policies and procedures, but the documentation is going to tell you what's actually happening in the program. So I'm going to look at the individual's daily notes. I'm going to look at the nursing logs, the behavior data. I'm going to look at anything that's available to me. And I'm going to evaluate if the documentation is matching the care plan and matching what staff are supposed to be doing. I'm also going to look to see if that documentation indicates that there is an observed change of status for that individual. So I discussed earlier that this individual needed 1-inch pieces, has a history of choking, swallowing, and aspiration pneumonia. If the documentation is showing that they're exhibiting challenges with 1-inch pieces, they're coughing during mealtime, they're having difficulty swallowing, maybe they've had a few choking incidents where staff were able to successfully dislodge the item. If that's in the documentation, I'm then going to look at the communication across providers, and I'm going to look to see if that documentation was reviewed the way that it should be, and whether or not that information was reported the way that it should be. Was the nurse made aware? Was the doctor made aware? Speech therapist, nutritionist, whoever's involved in that individual's care should be made aware that there's a change in status, because that individual's care plan might need to be revised. Their level of supervision may need to be changed. Their diet might need to be modified further. So these are all the things that I'm going to look at, and then some. And what I'm going to do is evaluate whether or not the policies and procedures were accurate and reasonable. Was the care plan current, and did it represent the individual? Was there training that was effective? Were the staff's competency measured? And were they provided oversight? And then, was the documentation accurate and representative of the individual? And were any necessary changes communicated across these providers? Now, once I've reviewed all of those things, I'm going to then look at the actual incident and look at the staff's response. So in this situation where an individual choked, did staff respond correctly in line with expectations and the training that they received? So staff need to have all sorts of certifications and trainings to work in these programs. And typically that involves any abuse prevention, CPR, first aid, things like that, and then program specific training. So for this, I definitely want to make sure that their CPR training is current and that they passed any practicals that they needed to. So I want to make sure that this staff knew how to perform CPR if it was warranted with this choking incident. Did the staff perform the CPR if it was required? Did they perform the abdominal thrusts, the back blows? Did they call 911 when it was necessary? So I'm going to look to see if their response was in line with the training and if it was reasonable. And after I've done all of that, I'll have a clear picture if there was a breach of standard of care. And that breach can happen at any link in that chain. Now, you can have great policies and procedures, a beautiful care plan, your training was perfect, your staff received regular and ongoing supervision, all of the documentation lines up with this person's needs, everything is done correctly. But yet we're dealing with people, and people are going to do what people want to do. So you can have a staff that doesn't follow it for whatever reason. So you could have a breach of standard of care as it relates to that staff. Now, you can have a breach in another area. Maybe the care plan doesn't include the modified diet. Maybe the staff training didn't measure staff's competency in cutting pieces to 1 inch. That would lead to more of a systemic issue. Or this could just be an unfortunate incident that happened, because as much as we like to reduce the risk of injury and reduce the risk of incidents happening, unfortunately, sometimes something happens, and it doesn't mean that there was a breach of standard of care. As long as everything that was done was reasonable and in line with industry expectations, sometimes it's just an unfortunate thing that happens. So I think now we can open it up if there's any questions.
Thank you very much, Danielle. As we said in the beginning, if you do have any questions, you can submit them via that Q&A button at the bottom of your Zoom window. First question to kind of kick it off, Danielle, when you were talking about the training that staff receive, depending on what roles they have, are there sort of standardized training organizations or anything like that, or is all of the training really falling on the agency or the facility itself?
Okay, great question. So typically you have your state mandated trainings, and those are often done through the orientation process, and training materials are provided through some state organizations, depending on the training that it is. So CPR and first aid is usually done in line with the American Red Cross training. So that's something where the materials are provided. You need to have trainers that are certified in that. When you're talking about restrictive techniques in response to a crisis or a behavioral emergency, again, that's something that is approved by each state. So each state's going to have their approved physical techniques, and trainers need to be certified trainers. Now, agencies sometimes will have their own in-home or in-house trainers that are certified. A lot of the larger agencies do that because it's actually more cost-effective for them to have their own in-house trainers versus contracting that out to an external provider. But there are training programs available. The ARC offers a lot of them. That's a national organization. And then again, each state has their own training requirement when it comes to abuse prevention, developmental disabilities, and things like that. And a lot of that can be done. There's some online services that agencies use that provides a lot of those training materials.
That makes complete sense. Last chance for any questions. And you can also, of course, email us. Our contact info is on the screen. You can look at Danielle's full bio and her CV if you go to robsonforensic.com/Dieterich, as you can see on the screen. Thank you all again for joining us this afternoon, and thank you, Danielle, for putting this together. We look forward to seeing you all in the next one.